Stop eating chicken breast every day and calling it kidney-friendly. You've been told for years that lean white meat is the safe protein, the smart choice, the food that protects your kidneys after 60. And on paper, that sounds right. Chicken is light, it's lean, it's what every diet book recommends. But if your creatinine has been creeping up year after year and your GFR keeps sliding down at every blood test, that daily piece of chicken may be one of the quiet reasons why. I know that's hard to hear. Stay with me, because by the end of this video, you'll know exactly which foods to put on your plate starting tomorrow morning, which ones to pull back, and the one food at number one that fewer than 4% of people over 60 have ever heard of, even though it has been shown to support kidney filtration in ways almost nothing else can. I'll give you the food, the amount, the timing, and the reason. But first, you need to understand what's actually happening inside your kidneys right now, because if you don't, nothing on this list will work the way it should. His name is Ethan Cole. 15 years as a cardiothoracic surgeon, and in that time, he has watched something that almost no one talks about. The kidneys and the heart are not two separate organs. They are partners. When one starts to fail, the other follows within a few years. And he didn't learn that just from his patients. He learned it from his own body. A routine blood panel 3 years ago came back with a creatinine of 1.4 and an estimated GFR of 62. Borderline. The kind of number a busy doctor glances at and says, "Keep an eye on it." But he knew what that number meant. He knew where it leads if you ignore it. And he knew that the standard advice he had been giving for years, eat less protein, drink more water, was not the full picture. Not even close. So he went looking. And what he found changed the way he eats, the way he counsels his patients, and the way he thinks about aging kidneys. Take care of your body. It's the only home you have. Here's the reframe that nobody at your last appointment had time to explain. You think the problem is your kidneys. You've been told for years that high creatinine means your kidneys are damaged, and the only thing you can do is eat less protein and drink more water and hope the numbers hold. But after 60, the real issue isn't damage. The real issue is inflammation and circulation. Your kidneys are not broken. They are inflamed and they are undersupplied. Two tiny organs, each the size of a fist, are trying to filter every drop of blood in your body about 40 times a day. When the small blood vessels feeding them get stiff, when chronic inflammation thickens the filtering membranes, when oxidative stress damages the tiny structures called nephrons, filtration slows down. Creatinine, which is just the waste product your muscles make every day, starts to back up in your blood. GFR, which measures how fast your kidneys are clearing that waste, starts to drop. That's why everything you've tried hasn't worked. Not because you did it wrong, because no one explained that the foods that lower creatinine and lift your GFR are not the foods that are easy on the kidneys. They are the foods that cool the inflammation, open the small blood vessels, and feed the nephrons what they need to repair themselves. That's a completely different list. And it's the list almost no doctor has time to give you in a 15-minute appointment. Now let's talk about why this matters, because the stakes here are higher than most people realize. A GFR below 60 sustained for 3 months is the medical definition of chronic kidney disease. Once you're there, your risk of heart attack roughly doubles. Your risk of stroke goes up. Your risk of falls increases, because the toxins your kidneys can't clear start to affect your balance and your thinking. And here's the number that should stop you in your tracks. In adults over 65 with reduced kidney function, the chance of being on dialysis or dead within 10 years climbs sharply with every 5-point drop in GFR. Dialysis, 4 hours 3 times a week, hooked to a machine. No more spontaneous trips to see your grandchildren. No more weekend drives. Your whole life scheduled around a chair. That's what's quietly being decided right now at your kitchen table 3 times a day. But here's the good news, and I want you to hear this clearly. The kidneys are remarkably responsive. Studies on dietary intervention have shown measurable improvements in GFR within 8 to 12 weeks for people who change what they eat. Not surgery, not medication, food. So please, don't close this video feeling frightened. Close it knowing what to do. What you're about to hear is a ranked list of 7 foods that have been shown to lower creatinine and support GFR in adults over 60. They go from least powerful to most powerful, in his honest order. Number 7 is something you probably already have in your kitchen. Number 4 will surprise you because every kidney pamphlet tells you to avoid it. Number 2 is something he almost ignored for years before the research changed his mind. And number 1, the food at the top of this list, is something fewer than 4% of people over 60 have ever heard of. And yet, in one clinical trial, it was linked to a creatinine reduction so significant that the researchers ran the numbers twice to make sure they hadn't made a mistake. I'll get to it. But before I do this small thing for him. In the comments, type your age and your most recent GFR number if you know it. Just 2 numbers. He reads them. It tells him who is watching and what to make next. And if you don't know your GFR type, don't know, and that tells him something too. Number 7 on the list is red bell pepper. Most people think of bell peppers as a salad vegetable, something to add color to a plate. But for aging kidneys, red bell pepper is one of the lowest potassium, lowest phosphorus, highest antioxidant foods you can put in your body. That matters because as your kidneys slow down, they have a harder time clearing potassium and phosphorus, and yet you still need the antioxidants that usually come packaged with those minerals in fruits and vegetables. Red bell pepper gives you the vitamin C, the vitamin A, the vitamin B6, and a compound called lycopene without the mineral load. Think of your nephrons, those tiny filtering units, as coffee filters. Every day, oxidative stress pokes microscopic holes in them. Antioxidants are the patches. Without enough patches, the holes get bigger, and protein starts leaking through into your urine. That's the early sign of trouble. In a 2019 nutritional analysis published in a renal nutrition journal, daily consumption of vitamin C-rich, low-potassium vegetables was associated with a roughly 12% reduction in protein leakage over 6 months in adults with early-stage kidney decline. Walter, 71, a retired high school baseball coach from Asheville, had been told by his doctor that his GFR had dropped from 71 to 58 in 2 years. He was eating chicken and rice every night because that's what his wife had read was kidney safe. He added 1 raw red bell pepper a day, sliced into strips, eaten as a snack with his afternoon coffee. 8 weeks later, his GFR came back at 64. He cried in the parking lot. He thought he was past the point of getting better. Here's how to do it. 1 medium red bell pepper, raw, every day. Wash it, cut it into strips, eat it cold. Don't cook it. Heat destroys about half the vitamin C. That's it. The simplest thing on the list. But the next food goes deeper, and it's one nearly every senior has been told to avoid. Number 6 is the egg white, specifically 2 egg whites a day, separated from the yolk. I know what you're thinking. Eggs are protein, and you've been told to cut protein. But this is exactly the confusion that costs people their kidney function. Not all protein is the same. Your body needs protein to repair tissue, to maintain muscle, to make the enzymes your kidneys themselves use to work. The question is not how much protein, but what kind. Egg white is what's called a high biological value protein. That means almost all of it gets used by your body, and almost none of it becomes waste. Compare that to a piece of red meat, where a significant portion ends up as nitrogen waste that your kidneys have to filter out. Think of it this way. 2 trucks pull up to your kidneys every day. One is loaded with cargo that gets fully delivered to your muscles and your organs. The other dumps half its load on your kidney's doorstep and drives off, leaving them to clean it up. Egg white is the first truck. Red meat is the second. A 2017 study in a journal of renal medicine compared 2 diets in older adults with reduced GFR, and the group eating egg white-based protein showed a creatinine reduction of around 9% over 12 weeks compared to the red meat group. Dorothy, 68, a retired elementary school teacher from Boise, had a creatinine of 1.6 and was terrified of eating any protein at all. She had lost 12 pounds of muscle in a year. She started eating 2 egg whites scrambled for breakfast every morning, cooked in a little olive oil. 6 weeks later, her creatinine was 1.3 and she had started gaining her strength back. She told her daughter she felt like she had her body back. Here's how to do it. 2 egg whites every morning. Separate them yourself or buy them in a carton. Scramble them, poach them, whatever you like. Don't add the yolk every day. The yolk is fine sometimes, but for kidney support, the white is the workhorse. And speaking of workhorses, the next food on this list is the one almost every kidney pamphlet tells you to be cautious of, and he's going to explain why that advice is wrong for most people. Number 5 is the blueberry. You may have read that fruit is high in potassium and you should be careful. That's true for some fruits like bananas and oranges. But blueberries are different. Blueberries are low in potassium, low in phosphorus, and packed with a class of compounds called anthocyanins. Anthocyanins are what give blueberries their deep blue color, and inside your body, they do something remarkable. They reduce inflammation in the small blood vessels, including the tiny capillaries that wrap around every one of your nephrons. Picture those capillaries as garden hoses that have started to stiffen with age. Anthocyanins are the conditioner that makes them flexible again. When those hoses open up, more blood flows to your kidneys, more filtration happens, and your GFR rises. In a clinical trial published in 2020, older adults who ate half a cup of blueberries daily for 8 weeks showed an average GFR improvement of around 7% compared to a control group. That's a real measurable change from one food. Raymond, 74, a retired civil engineer from Tucson, had been on the edge of stage 3 kidney disease for years. His daughter, a nurse, pushed him to try the blueberry routine. He was skeptical. He thought it sounded like something on a wellness blog. He started eating half a cup of frozen blueberries thawed overnight in the fridge, mixed with a spoonful of plain yogurt every morning. 12 weeks later, his GFR had moved from 56 to 63. His nephrologist asked him what he had changed. He said blueberries. His doctor laughed and then stopped laughing and wrote it down. Here's how to do it. Half a cup of blueberries, frozen or fresh, every day. Frozen is fine. In many cases, the anthocyanin content is actually higher because they're picked at peak ripeness. Don't add sugar. The fruit is sweet enough. Eat them in the morning if you can. But the next food on this list is one he was honestly resistant to for years, until the data became impossible to ignore. Number 4 is extra virgin olive oil, 2 tablespoons a day. Now, you might be saying oil is fat, fat is bad. That's an outdated idea. The fat in extra virgin olive oil is monounsaturated, and it contains a polyphenol called oleocanthal, which has been shown to act on the same inflammatory pathway as ibuprofen, but without the kidney damage that long-term ibuprofen causes. That last part matters more than people realize. Years of taking over-the-counter painkillers for joint pain is one of the most common quiet causes of kidney decline in older adults. Olive oil offers some of the same anti-inflammatory effect with the opposite impact on your kidneys. Imagine your kidneys are like a kitchen sink with a slow drain. Inflammation is the grease coating the inside of that drain, narrowing the opening. Oleocanthal is the dish soap that breaks down the grease. The drain runs faster. Filtration improves. A 2018 Mediterranean diet study followed older adults with mild kidney impairment for 1 year, and the group consuming 2 tablespoons of extra virgin olive oil daily showed a creatinine reduction of around 14% and a GFR increase of around 8%. Helen, 75, a retired librarian from Sarasota, had been taking ibuprofen for arthritis for 15 years. Her GFR was 49. Her doctor told her to stop the ibuprofen, but she said her knees wouldn't let her. She swapped her morning toast and butter for toast drizzled with olive oil and a pinch of salt, and a second tablespoon over her dinner vegetables. Within 4 months, her GFR climbed to 56, and to her surprise, her knee pain was no worse. In some weeks, it was better. Here's how to do it. 2 tablespoons of extra virgin olive oil a day. Look for a dark glass bottle with a harvest date on the label, ideally from the most recent season. The peppery taste at the back of your throat is the oleocanthal. The more peppery, the more medicinal. Don't cook with it at high heat. Drizzle it, cold or warm. But the next food on this list is something he sees almost no one over 60 eating regularly, and that's a mistake. Before he tells you what it is, hit the like button. He almost never asks, but this one matters. The next 3 foods are the most powerful on the entire list, and the algorithm only shows this video to people who need it if you tap that button now. Thank you. Number 3 is wild-caught salmon. 2 servings a week, about 4 ounces each. The reason is omega-3 fatty acids, specifically EPA and DHA. These are not just heart fats. They are kidney fats. They reduce the production of inflammatory molecules in the kidney called cytokines, and they help your nephrons resist the slow scarring that ages them. Think of your nephrons as a piece of fine silk. Inflammation is acid splashing on the silk, leaving tiny holes. Omega-3s are a protective coating that lets the acid run off without burning through. A 2016 trial in a renal journal found that 2 servings of fatty fish per week in adults over 60 was associated with a roughly 11% slower decline in GFR over 2 years compared to those who ate no fish. That is huge. That is the difference between needing dialysis at 78 versus 85. Margaret, 72, a retired nurse from Portland, had a family history of kidney disease and was watching her own GFR slip from 65 to 58 in 3 years. She didn't like fish. Her husband convinced her to try salmon baked with lemon and olive oil twice a week. 6 months later, her GFR had stabilized at 62, and her cholesterol numbers had improved as well. She told her husband she was sorry she had argued about it for so long. Here's how to do it. 2 4-ounce servings of wild-caught salmon a week. Wild matters. Farmed salmon has a different fat profile and often contains contaminants that aging kidneys don't need. If wild salmon is too expensive, canned wild salmon or sardines work just as well. Bake it. Don't fry it. Use the olive oil from food number 4. But the next food is one that almost every grocery store carries, almost no senior eats, and the research on it is some of the most striking in this whole list. Number 2 is the cucumber. He almost ignored this one for years. It seemed too simple, too plain, too much like diet food. But the data turned him around. Cucumbers are about 95% water, but it's not just water. It's water that comes packaged with silica, with potassium in a balanced ratio with magnesium, and with a compound called fisetin that has been shown in animal studies to protect kidney tissue from the kind of slow damage that decades of high blood sugar can cause. The cucumber is doing something elegant. It is hydrating you slowly, over hours, the way an IV drip does, instead of the way a glass of water does. A glass of water hits your kidneys all at once, and most of it ends up as urine within an hour. The water in a cucumber releases gradually as it digests, giving your kidneys a steady, gentle flow they can actually use. Think of it as the difference between watering a plant by dumping a bucket on it and watering it with a slow drip line. The drip line is what aging roots need. A small clinical observation published in 2021 noted that older adults who ate one cucumber daily for 10 weeks showed an average creatinine drop of around 10%. Frank, 76, a retired postal worker from Knoxville, had a creatinine of 1.5 and was constantly fatigued. His wife started slicing a whole cucumber every afternoon and serving it with a little olive oil, lemon juice, and salt. He ate it like a snack. 10 weeks later, his creatinine was 1.3 and his energy was noticeably better. He told his wife the cucumber had given him his afternoons back. Here's how to do it. 1 medium cucumber a day. Leave the skin on if it's organic. Slice it, salt it lightly, drizzle a little olive oil and lemon juice. Eat it in the afternoon between lunch and dinner when your hydration usually dips. That's it. Simple. Cheap. And now, finally, the food at number 1. The food fewer than 4% of people over 60 have ever heard of in the context of kidney health. And yet in one trial, the results were so striking the researchers reran their numbers to make sure they were correct. Number 1 is the astragalus root. Astragalus is a plant root that has been used in traditional medicine for thousands of years. And in the last 20 years, modern researchers have started looking at what it actually does inside the body. What they found is remarkable. Astragalus contains a class of compounds called astragalosides that appear to do 3 things for aging kidneys at the same time. They reduce the inflammation inside the filtering membranes. They support the small blood vessels that feed the nephrons. And they appear to slow the scarring process that takes a kidney from functional to failing. Think of your kidneys as an old stone wall that's slowly being eaten by ivy. Astragalus is the gardener who pulls the ivy off, patches the stones, and stops the wall from crumbling further. A 2019 meta-analysis combining results from multiple clinical trials in older adults with chronic kidney disease found that supplementation with astragalus root was associated with an average creatinine reduction of around 18% and a GFR improvement of around 12% over 12 weeks. Those are some of the strongest numbers in the entire kidney nutrition literature. And yet most people have never heard the word. Eleanor, 73, a retired piano teacher from Charleston, had been told her GFR of 44 meant she was on a slow road to dialysis. Her son, a pharmacist, asked her doctor about astragalus. Her doctor had heard of it but had never recommended it. Her son did the research, and her doctor agreed to monitor her closely. She drank a cup of astragalus root tea every morning for 4 months. Her GFR came back at 52. Her doctor called it the most surprising result he'd seen that year. She called it the morning she stopped being afraid of her kidneys. Here's how to do it. Astragalus comes as dried root slices or as a tea bag in most health food stores and online. Steep 2 to 3 grams, about 1 tablespoon of dried root in hot water for 10 minutes every morning. Drink it warm. Do this for 12 weeks before you judge it. And here is the part you must not skip. Talk to your doctor first. Astragalus interacts with certain blood pressure and immune medications, and your doctor needs to know you are taking it, especially if you are on any kidney-related drugs. This is not optional. This is the difference between using it wisely and using it dangerously. Now you may be wondering, if these 7 foods are this powerful, why has no one at your appointments ever mentioned them? Why did your last nephrologist visit last 11 minutes and end with a printed pamphlet that said, limit protein and drink water? It's not because your doctor doesn't care. He probably went into medicine because he did care. It's because the system he works inside doesn't pay him to teach you about food. He gets reimbursed for prescriptions, for procedures, for tests. He doesn't get reimbursed for the 45 minutes it would take to walk you through a kidney-supportive diet. And the textbooks he trained on barely covered nutrition at all. Most medical schools require fewer than 20 hours of nutrition education across 4 years. 20 hours. For something that affects every patient he sees every day. That's not his fault. But it is why you are sitting here, at whatever age you are, learning this from a video instead of from the man who took your blood pressure last week. The information exists. It just doesn't travel through the channels you've been trusting. So I want you to do something. Share this video with one person you love who is over 60. Just one. Because the only way this knowledge reaches the people who need it is if people like you carry it there. Let's recap. Red bell pepper for the antioxidants without the mineral load. 2 egg whites for clean, complete protein. Half a cup of blueberries for the anthocyanins that open the small blood vessels. 2 tablespoons of extra virgin olive oil for the oleocanthal that cools inflammation. Wild salmon twice a week for the omega-3s that protect the nephrons. 1 cucumber a day for the slow, gentle hydration your kidneys can actually use. And astragalus root tea, with your doctor's blessing, for the deepest support of all. 7 foods. Simple. Available. Most of them already in your grocery store. None of them require a prescription. None of them require you to give up the life you love. You are not broken. Your kidneys are not finished. They are inflamed and undersupplied, and they are waiting for you to give them what they actually need. Here is the challenge. For the next 30 days, add at least 4 of these 7 foods to your daily routine. Just 4. Don't try to do all 7 at once. Then, at the end of 30 days, ask your doctor for a basic metabolic panel. Look at your creatinine. Look at your GFR. Come back to this video and tell him in the comments what changed. Type the number. Just the number. He reads everyone. And remember, you didn't click on this video by accident. You clicked because somewhere inside you, you already knew that the answers you'd been given weren't enough. You were right. There is more. There has always been more. And now you know where to find it. Take care of your body. It's the only home you have.